There's now a safer and more effective way of diagnosing blocked arteries in the heart, especially among women. It's thanks to a homegrown study involving hundreds of patients across the Central Coast and Hunter.
Only recently, Shirley West had a procedure to unblock one of the arteries in her heart.
I had heaviness to the chest. I mean, even eating was a challenge.
At Gosford Hospital, the 61-year-old was treated by doctors to clear the hardened calcium and insert a stent. Instead of the old way of using the femoral artery near the groin to access and treat the heart, doctors used her wrist.
The reason for that is it's preferred by patients because they have a better recovery.
Problem is, the hardware on the left, which was designed for the groin, has stayed the same.
Now, the equipment, Gabby, hasn't changed since the femoral days of over 20 years ago.
So this smaller guide wire, called Baby J, is being used. A recently published study involving 330 patients showed that using the smaller wire resulted in greater technical success. There was less pain, radiation exposure and bleeding events. The benefits were bigger among women who have smaller arteries.
The procedure itself was more comfortable and we were able to have more technical success doing it.
I went home 5 hours later. After the procedure, 5 hours.
In Australia, 150,000 of these heart procedures are performed each year. The results of this study will likely impact clinical care. In Gosford, Gabriella Rogers, NBN News.
Sport now with Jack Howard. Jack, it was the perfect start for the Aussies in Perth.
Good evening, Gab.